Bismillahirrahmanirrahim. Qalu subhanaka la ilma lana illa ma 'allamtana innaka antal alimul hakim. My name is Mehdi Hassan Mumtaz. I'm Professor of Anaesthesia and Intensive Care Unit, and I have started recording these lectures because basically I'm a teacher and I have been teaching in National Medical College Multan, and I joined National Medical College Multan in 1980. I retired from there in 2004, and throughout this period, so almost 148 people passed their post-graduation exam, and they have been working in different capacities. Some of them have retired as a professor also. To start with, I was 1.5 years old when we migrated from India to Pakistan. I settled down in Burewala. I did my matriculation exam from Municipal School Burewala, then did my FSc from Municipal Degree College Burewala also, did my MBBS from National Medical College Multan. Then in 1971 December, I went to England and started working in 1972 and passed my fellowship exam in Anesthesia and Intensive Care Unit in 1977, and then became consultant in Birmingham, in Queen Elizabeth Hospital, Birmingham. But then I decided to come and serve my own country. Particularly, I wanted to work as a teacher in National Medical College Multan. So I came and took my job as a contracting assistant professor in 1980. Then I was promoted to chair of professor in 1987. But I remained head of the department throughout this period. So I tried to modernize the Department of Anesthesia and Intensive Care Unit, and then I started first intensive care unit in whole Pakistan in 1980. And I introduced this intensive therapy to Pakistan. There was no Aachen University Hospital or Sheikh Hospital in Pakistan that time. Then I went to every district headquarters and Tehsil headquarters to promote the intensive therapy. And the first intensive care unit, which was started in National Medical College Multan, it progressed with the collaboration of my senior principal and MS, and I went on promoting this specialty. Then I organized the first intensive care society of Pakistan and became the founder president of Pakistan Society of Intensive Care. When I retired, then I started working in our own private medical college, private hospital, and that is a Medicare hospital. And then I started intensive care unit here also. Total period which I worked in England as a consultant and as a trainee was about 17 years in England, and most of my work was in intensive therapy. Intensive therapy is my own specialty. It's based on my interest in physiology and pharmacology. And in intensive care unit, all the management depends on cell level, because when the patient is sick at a cell level, then the patient needs intensive care. So this is being practiced in my intensive care unit and all other good intensive care units in Pakistan also. Now, as far as I gather from different intensive care units in South Punjab or even Punjab also, we are second to none. And in Medicare Hospital, our intensive care unit is one of state-of-the-art intensive care unit. I still provide my services, and I reach hospital at 7:15 and leave hospital at 9:30, and even at night I'm on call. And I personally give my attention to every patient, and I love doing it, and the teaching is my passion. And I love to teach, so that's why we have made educational center also on the 4th floor Medicare Hospital.